The clock is ticking in Washington. Today is Tuesday, September 30th, 2025. A critical deadline is just hours away. If lawmakers cannot agree on a spending plan, the United States government will shut down at 12:01 in the morning tomorrow. This isn't just political drama. A shutdown has real consequences for millions of Americans. It can halt government services, furlough federal workers, create deep uncertainty. Following a tense and ultimately unsuccessful meeting at the White House on Monday, the path to a last-minute deal appears narrow and fraught with disagreement. The air in the Capitol is thick with tension as both sides dig in their heels. This situation became much clearer when Vice President J.D. Vance emerged from the failed negotiations. He did not offer words of hope or compromise. Instead, he delivered a stark warning, predicting a shutdown was now almost certain. He placed the blame squarely on the shoulders of the Democrats, accusing them of holding the government hostage. This high-level finger-pointing highlights just how far apart the two parties are. At the heart of this standoff is a fundamental conflict over policy. Republicans, led by figures like Senate Majority Leader John Thune, are pushing for what they call a clean funding bill. This means legislation that only provides money to keep government agencies running. They say this avoids a shutdown by separating the essential task of funding the government from other, more contentious political debates. From their perspective, Democrats are introducing unrelated issues, specifically healthcare, into a must-pass bill, a tactic they call unfair and manipulative. On the other side, Democrats are steadfast in their demands. They argue a spending bill can't be detached from the real-world impact on American families. Their central demand include provisions to extend healthcare subsidies and to secure those subsidies for millions. These subsidies help lower insurance premiums for individuals and families. Democrats have rejected Republican stopgap proposals because those bills lack these protections. They say they've been shut out of the budget process and are using their leverage to force a conversation about a critical lifeline for constituents. The rhetoric has grown heated, showing a deep divide. Senator Thune accused Democrats of hostage-taking, framing it as a political game with government stability as the pawn. That imagery casts one side as willing to risk crisis to get policy wins. Republicans insist healthcare debates should happen through the normal legislative process, not under the threat of a government shutdown. This political battle is not an abstract exercise. If the healthcare subsidies at the center of the dispute are allowed to expire, the financial consequences for millions of Americans could be devastating. According to KFF, a respected nonpartisan health policy research group, the average insurance premiums for those affected could skyrocket by approximately 75%. An increase of that magnitude would make health insurance unaffordable for many families overnight. People who have relied on this assistance to manage their budgets and maintain coverage would suddenly face impossible choices between paying for healthcare rent or groceries. This is the real-world impact that fuels the Democrats' urgency. The ripple effects would extend far beyond individual households. The healthcare system itself would face a severe financial shock. The same KFF analysis projects that healthcare providers, such as hospitals and clinics, could lose more than $32 billion in revenue. In addition, these providers could be saddled with an extra $7.7 billion in uncompensated care costs, the unpaid medical bills left behind by uninsured patients. This kind of financial strain can force rural hospitals to close and urban clinics to cut back on essential services, affecting entire communities. For the individuals caught in the middle, this is a moment of profound anxiety. Imagine being a parent of a child with a chronic condition or a person managing a serious illness like diabetes or heart disease. Your ability to afford life-saving medication and necessary doctor visits is directly tied to the outcome of this political fight. The current showdown is not happening in a vacuum. It is unfolding against a backdrop of intense political maneuvering, where every move is calculated for maximum effect. The president has injected a new and volatile element into the situation by threatening to take unprecedented action if a shutdown occurs. He has suggested the possibility of mass firings of federal workers, a move that would dramatically escalate the consequences of the funding lapse. This threat goes far beyond the typical furlough notices seen in past shutdowns and represents what some observers call an aggressive assertion of executive power. It adds another layer of fear and uncertainty for the hundreds of thousands of people employed by the federal government. As the midnight deadline approaches, the nation is left in a state of suspense. Breaking news alert on phones and TVs, Capitol at night, tense atmosphere. The government shutdown, once a possibility, now seems a near certainty. We've seen a fundamental disagreement over healthcare funding. That disagreement has driven a wedge between the two parties. Negotiations have completely broken down. Vice President J.D. Vance speaks out. Republican leaders are calling out Democrats. They blame Democrats for taking the government hostage. Republicans demand a clean bill that only funds government operations. Democrats say they're protecting millions from losing vital healthcare subsidies. Many people rely on marketplace subsidies for coverage. Democrats say their exclusion from the budget process forced this stance. The stakes extend far beyond the walls of the Capitol. If subsidies disappear, millions could see premiums spike by about 75%. Hospitals could face billions in losses. Clinics could also be hit hard. That could lead to service cuts and even closures. This isn't just political. It's a crisis for health and financial security across communities.